Hi, everyone. I'm Rachel Werner, the Executive Director of Penn's Leonard Davis Institute of Health Economics. Welcome to today's seminar. Over the course of this spring, LDI has hosted a series of virtual seminars on the health crisis created by the COVID-19 pandemic. But today we're going to turn our attention to a different health crisis, one that is long-standing and pervasive with profound effects on health. Today, LDI is hosting the first in a series of conversations about structural racism and its impact on health. LDI is a community of scholars that includes people from many different backgrounds, races, ethnicities, and cultures, and we are committed to the ideals of inclusion and diversity. But we are now challenged to live up to those ideals, to directly address long-standing racism, and to do more to turn those ideals into reality, to help lead us to a better and more just future. One small but important part of that is to bring people together to have conversations like the one we have planned today. Today's topic of policing is a critical part of our conversation about structural racism and a fitting start to LDI's series on racism and health. Because, simply put, people are dying. People are dying from the slow harms of sustained exposure to racism and trauma from policing, and people are being killed in the streets at the hands of police. Not long ago, it may have seemed inconceivable to have this conversation about how to fundamentally change the current police system, let alone to abolish it. However, in the wake of the murder of George Floyd and others, we are at a critical inflection point in American history. We are at a moment when we are called to stand up to the long-standing institutional racism and to stand up for racial and economic justice. And so I'm really pleased to host this conversation today in collaboration with the Penn Injury Science Center on policing, race, health, prospects for reform. So to start, I'm going to introduce our outstanding lineup of panelists today. First, Rachel Hardiman is an associate professor in the Division of Health Policy and Management at the University of Minnesota School of Public Health. Professor Hardiman is a reproductive health equity researcher whose research links structural racism to health in a tangible way, identifies opportunities for intervention, and dismantles the systems, structures, and institutions that allow inequities to persist. Her work has also elicited important conversations about culturally centered care and police brutality. Next, Mr. Edwin Lindo is a critical race theory scholar, educator, and community organizer. He serves on the faculty in the Department of Family Medicine at the University of Washington School of Medicine. He teaches, presents, and writes on issues of race and racism within medicine and society. He is also the creator of the Praxis podcast, which seeks to address and explore the effects of racism and other forms of marginalization so that we can achieve health justice. John McDonald is a professor of criminology and sociology at the University of Pennsylvania. Professor McDonald studies interpersonal crime and violence, race and ethnic disparities in criminal justice, and the effect of public policy responses on crime. He also examines how policies and programs around land use can reduce crime and violence in neighborhoods. Charles Ramsey is the former commissioner of the Philadelphia Police Department and has decades of service in law enforcement in 3 different major city police departments, including serving as chief of the Metropolitan Police Department in the District of Columbia. In 2014, Commissioner Ramsey was selected by President Obama to co-chair the President's Task Force on 21st Century Policing. Our panel will be moderated today by Penn's Terry Richmond. Terry Richmond is the Andrea B. Laporte Professor at Penn School of Nursing and serves as Penn Nursing's Associate Dean of Research and Innovation. She also directs the research core of the CDC-funded Penn Injury Science Center, which is a collaboration between nursing, medicine, and criminology, and is a co-sponsor of today's seminar. Professor Richmond's research examines the disparate impact of injury, violence, and recovery on vulnerable populations, and has extensively examined the disparate effects of serious injury in urban Black men, the broader environmental factors that affect long-term recovery. So with that, I'm going to hand over this panel to Dr. Richmond.
Thanks, Rachel. I'm absolutely delighted to moderate this important panel on policing racism and health on behalf of both LDI and the Penn Injury Science Center. So police and policing are the focus of today, but it's important that we're very honest and recognize that police departments are a function and reflection of our broader society. which has serious and embedded structural racism. Police actions have uniquely and detrimentally impacted the health of Black communities. We see visual evidence of this in the media. We see evidence in research studies, most recently a study by Wirtz in the Journal of Urban Health that used the National Violent Death Reporting System, showing that, and I quote, Black Americans are not only disproportionately likely to be killed by law enforcement, but are disproportionately unlikely to present an objective threat of deadly force. The pervasiveness of the problems of policing in the Black community indicates this is not a question of bad police actors, but rather a systemic and structural problems in policing. We need solutions that need to be carefully thought out. We are seeing a national dialogue devolving into a dichotomous choice of funding and not funding police. As a gun violence researcher, I'm sensitive to the fact that such a dichotomous choice, such as pro-gun and anti-gun, is not particularly helpful. Rather, we need to identify solutions that can be transformative. So while we call this reform, we really need to be transformative to reach the ultimate goal of keeping all people and all communities safe and healthy. So we have an impressive panel of scholars and leaders who come from different disciplines, different worldviews to help us consider the problem and to inform solutions. My first question is for Rachel. So Rachel, you've written about police brutality as a public health issue. Even in the absence of physical violence, several studies show that police stops that are perceived as unfair, discriminatory, or intrusive are associated with adverse mental health outcomes, including anxiety, depression, and PTSD. Can you tell us what your work shows about the effects of these encounters with police have on Black people and Black communities?
I want to start out by laying out what public health is, right? So the CDC, the Centers for Disease Control, our nation's premier public health agency, says that public health is the science of protecting and improving the health of people in their communities. So, overall, we have this goal, right, of protecting the health of entire populations, whether that's a local neighborhood, a small community, a country, or a region of the world. And I think we've used the social determinants of health framework to do that and to have these discussions about how to improve population health and health equity in particular. But I think what only a subset of public health scholars are doing right now is really naming and measuring and understanding what's at the root of social determinants, and that's structural racism. And police violence is one form of structural racism that shows up. And so, I think it wasn't until 2018, right, when APHA, the American Public Health Association, the other sort of arguably premier, agency for public health, named law enforcement violence or police violence as a critical determinant of health equity and public health. And that was despite sort of this evidence that has been built over the years, both mine and colleagues like Dr. Syria Long at Lehigh University, where we, looked at and named sort of the five ways we see police brutality as a determinant of health. So everything from, that harm that's happening to the individual, but also what it means to live in a community where this trauma is playing out. And then understanding further than that, the age of social media has allowed national consumption of police violence in a way that is incredibly harmful for the mental health and well-being of Black folks across our country. And, we also know from some of the local research I've done, pilot work, that for reproductive health, this is an incredibly important thing to consider. And the fact that living in communities where police violence is happening, particularly those high profile cases like we've had here in Minnesota over the past 4 years, is harmful for reproductive health outcomes in our communities. And so we have a lot of evidence and ways that we understand the impact of police violence on public health and health outcomes, and also on how Black communities are thinking about accessing healthcare, right? So some of our work has also shown that folks who have had an encounter, Black folks in particular, who have had a negative encounter with a police officer, with law enforcement in some way, have higher levels of mistrust of medical institutions. And so we really also need to consider what that means for how people are choosing to access or not access care, particularly within the context of the global pandemic that we're facing.
Thanks, Rachel. John, you're a criminologist, you're a researcher, you live and are embedded in a world of science. Can you speak to what we know from science and how what we know can guide transforming police to help improve the health and well-being and safety for all of our communities? And does the evidence really guide us for what kind of reforms we should make or transformation that we can make?
You could think about both what's a police function and what's a public health function. In the area of kind of public health, I think you can think beyond the police. I mean, especially when we're getting to issues like structural inequality and structural racism, is thinking about the context in which people live, work, where they have recreational opportunities. So a lot of the work that I've been doing has been focusing on how we can redesign places to make them safer and healthier in the first place, so that maybe you don't require the same level of policing that is experienced in an area where there's a lot of violence and a lot of calls for service. In the context of policing, I mean, I think it's obviously we wouldn't be here. This is a critical issue. It's not a new issue. Every major urban unrest and uprising since the 1960s, with the exception of WTO and a couple other, Occupy Wall Street, have always been sparked by instances of police brutality, in particular in the Black community. And so to me, it's an evolving issue that we need to figure out how to address. There is some work to suggest that you can improve outcomes for example, between police and citizens by changing policies, changing incentives. I think Chief Ramsey will have more to say about that. But I think one of the critical issues is, what are the incentives for officers when they're policing a community? Are they engaged in community policing? Are they incentivized to engage in extra stop, question, and frisk activity? And I think if we look at, kind of where the science is evolving, it's suggesting, for example, that putting police in high crime areas is important for reducing crime, but they don't actually have to engage in intrusive stops. A more engaged kind of interaction with the public that's less about weeding out criminal behavior and more about building social capital between police and communities. There's some evidence of effective efforts on those fronts. There is some research evidence evolving suggesting that specific types of reforms often that come through court interventions can be effective in terms of changing training, changing emphasis again on the form of policing that's occurring. I can get into more specifics about that, but I think there is an evolving evidence. It's not that, we don't know anything, but this is a tough issue, that the American society has been dealing with for decades.
I'm going to hand this off to Chuck, right? Since you referred to him, and he brings certainly a unique lens. So Chuck, you co-chaired the President's Task Force on 21st Century Policing. So we're in the 21st century, and we have a desperate need, right, for new approaches to enhance safety in our communities. What advice do you have for where we need to go from where we are today and how we can really improve the health and safety of everyone in this country?
That's a very good question and a very complicated question. There's an awful lot of work that has to be done, and it goes way beyond police. We talk about systemic racism and in the context of policing. We haven't been able to eradicate systemic racism from our society. I mean, in 400 years. So it's not practical to think that we're going to be able to eliminate it from policing overnight. Now, having said that, it doesn't mean that there aren't steps that can be taken to really minimize the opportunity for people to engage in that kind of behavior. And I think it starts with our recruiting, how we bring people into the department, the psychological testing that we give. It's about accountability, making sure that officers do what they're paid to do. You can change policy, and all these things are important, and training, implicit bias training, and all those kinds of things. But if you don't change a person's heart, then you're going to still have a problem, and that's the difficult thing. I started my policing career in 1968. That's a long time ago, and I recall when racism was certainly more open, more apparent in policing. I started in the Chicago Police Department. Now, you're not going to find anything in policies, procedures, training that would indicate that there's, either racism, bias, or whatever. I mean, that's going to be pretty much right down the line. But here's where it exists. For an example, in 1968, the big social experiment, if you will, in the Chicago Police Department was putting a black and white officer together in the same car. It was called an experiment, just to see if a black and a white officer could work together in the same car. There were no women in patrol at all. Women were either youth officers or they served as matrons in women's detention. And black officers could only work in black areas. When you were assigned your beat was definitely in a 98, 99% African-American community. You did not work anywhere else. And so even though that wasn't written anywhere, that was the way things were. So I can see where there's been some progress, but I also know that a lot of that stuff still exists. I was listening to Rachel, and I found it very interesting when she was talking about trauma in the various communities. That trauma impacts police officers as well. Because when you're exposed on a regular basis, depending on where you're working, I worked in some pretty rough areas, the west side of Chicago. D.C. was no joke back in the 90s. And, of course, Philadelphia has more than its share of issues. It does affect you. I mean, I've worked in homicide, for an example. And when you get desensitized for dealing with murder victims and so it psychologically impacts you. We need to do a better job of taking care of the mental health of police officers because sometimes, in my opinion, a lot of that translates into some of the aggression that takes place on the street, of fear that develops when you're working in certain communities because your sense is that everybody is doing whatever, criminals or what have you. And that's why community policing is so important. In Philly, I started all recruits out on foot beats in some of our most challenged neighborhoods. Why? Because they need to learn early on that there's more decent, law-abiding people living in that community than there are criminals. You don't know that when you're driving down the street with your windows rolled up at 30 miles an hour. You know it when you're out there on foot beat and you have a chance to interact and talk to folks. You learn that all kids are not, gangbangers or bad kids. They want the same things your kids want. And so you learn those things through interaction, through getting to know people. That starts breaking down stereotypes. That starts changing the way in which you interact with people. But there is a bias. Sometimes it could be outright racism. A lot of times it's bias that really exists. There's no question about it. I'll give you a real quick example. Just here in Philadelphia, in Fishtown, for an example, where you had a group of predominantly men, white guys with shovels, with baseball bats, and sticks, call themselves protecting the neighborhood from protesters. Flip the script. If that had been Black Lives Matter walking down the street with shovels, sticks, and bats, what do you think would have happened? It certainly would have had a different outcome, in my opinion, simply because the perception of black people in that position would have been totally different. Michigan, where they took over the state capitol because they didn't like when the governor was shutting everything down because of COVID. These images of largely white groups with men with AR-15s literally slung over their shoulder inside the state capitol. flip the script and make it all black people in there. They would have called SWAT teams from LA to be there to help deal with that particular situation. It's how we perceive one another. Those kinds of stereotypes have to be broken down. And it's not just a policing problem, it's a societal problem. And so we have an opportunity to deal with it, but we're making a mistake if we narrow the focus too much on police, although I understand the need because the authority and the power that police have, it's incredibly important. But we're missing an opportunity to deal with the larger issues because police will always be drawing from the society at large. And if you come to us with those attitudes, don't think it's going to automatically change just because you raise your hand and take an oath. So we need to deal with the problem very aggressively, in my opinion, but it is fixable. It's just going to take some time and effort.
So in 2016, you were one of the Frisco Five who went on an 18-day hunger strike in protest against police killings of Black, Brown, and Indigenous community members, which led to the resignation of the San Francisco police chief. What has your experience taught you about the tactics needed to achieve police reform and the likelihood that significant change in policing can happen in the wake of our ongoing national protests?
I appreciate you bringing up that time. I want to give one recognition to the land through which we are standing on from wherever we are, the Native Indigenous people that have been the stewards for this land to allow us to even have this conversation. So putting that out there first. Secondly, to the history of organizing that has taken place in the Bay Area where I grew up, that allowed us to even take a bold step to sit in front of a police station for 18 days, not eating, demanding justice for Mario Woods, Alex Nieto, Luis Gongora Pot, and people saying, you're wild, you've lost your mind. You are legally trained. Why are you sitting here, not eating, asking for a police chief to be fired? And the truth is because reform, tried in so many different ways, has proven to be just that. It's been a reformation of practices that are incredibly oppressive. And I want to speak, you asked what tactics? I think the first tactic is for us to have a deep-seated political education of the truth of this country. But that's grounded in actually doing a significant amount of work of reflexivity, of critical understanding that what we learned in school is actually so far from the truth because we've eliminated the voices of the people who are telling us that this is wrong. And so for me, a critical tactic is to declare openly that I am an abolitionist. I'm an abolitionist not because I'm intellectually lazy and I want to essentialize and suggest that, oh, this is the answer. I'm an abolitionist because it is intellectually rigorous. It is a rigorous understanding that when we say abolitionist, we mean that I actually, to Commissioner Ramsey's point, this harms police officers as well. And what I'm asking is, we shouldn't be putting them in those situations to be constantly traumatized the same way that our community is traumatized, because they are actually, when they put the badge on, having to be dehumanized in the practice of believing that they have the authority to declare that someone is a criminal. And that's unfair to both our community, but also to them as well. And so the abolitionist is not saying remove accountability, remove public safety. Abolitionist means, in the words of Octavia Butler, that we have to use our imagination in such a way that we're thinking of something we've never seen before, and that's justice. The justice that we're talking about, we've never experienced, so it feels foreign. It feels different and actually feels very uncomfortable. And if you look at the data, Dr. Rhea Boyd has spoken to this quite a bit, Dr. Rachel Hardiman, and a number of other amazing Black scholars. But being a young Black man in this country means that death by police violence, or as our good brother, Dr. Roger Mitchell, the chief medical examiner in DC, tells us, death in custody is the leading death for young Black men. That's wild to me, that it's not even a pathology of the physical kind, but I suggest that racism is a pathology that we need to look into, that we need to extract from the social ills of this country. But we also have to understand, if we're talking about reform, we need to know the history of what the foundation of policing is. And many people may have heard this, but in the South, right, we're talking about slave catchers that were deputized with a badge that said, catch that property that's running away from my plantation. But what's so sad, and this is my analysis, what's sad is at that time, they had to bring them back alive. Now, that isn't a mandate that they be brought back alive, and that's the sad part. And I want to say that we've lost the humanity in the engagement of accountability. And so I think we have an opportunity here to say, let's reimagine. Let's take Octavia Butler's words and say, maybe policing isn't the thing. It's a relatively new innovation when we talk about police departments. The first police department was 1838 in Boston, Massachusetts, and their sole purpose was to protect the property of the ships that made it to the port. If that's the purpose, then maybe they're actually doing what they were initially, and the impetus was it for. How do we actually create a mechanism where the first responders to a mental health crisis is not carrying a loaded weapon? I say all this to your question because you say, well, what are the tactics, Edwin? The tactics are that we have to know this history. I am not here to demean or to reprimand the individuals as saying that they have poor souls or that they're terrible people. What I'm reprimanding is the blue uniform and the badge that folks are carrying, as though it is a badge of trial executioner. And we're supposed to have a system for that. But apparently now it falls in the hands of a few individuals. The last point I want to make is we're talking about human rights violations of the most severe kind. If you are to look at the UN Convention and their definition of asylum and or refugee, it is someone who's unable or unwilling to return to their country of origin owing to a well-founded fear of being persecuted for reasons of race and a number of other reasons. By definition, in these United States, police and the oppressive nature of racism in this country can allow Black folks, and I'm not encouraging this, but if they were to go knock on the door of Canada, they would have all the right in the world to say they are fearing racial persecution and Canada has an obligation under international law to accept them. That means that in our own borders, we are creating refugees and we're not doing anything about it.
Thanks, Edwin. I think it's important to echo, Edwin, what you just described. It's not, in my mind, this isn't a discussion of reform. It's a discussion of reimagining, and reimagining what public safety means, and asking folks who don't feel safe right now, what it would take for them to feel safe. What do they need? You know, some of my research has shown that just simply living in a community where there is a large police presence, and I'm not talking about violence, I'm not talking about, even encounters, but simply existing and living in your day-to-day in a community where there happens to be more, well, not happens to be, where there are systematically reasons for more police presence and police patrol, that is harmful to health, particularly to preterm birth and in those communities. And so I think the conversation has to be around reimagining and starting with asking folks what it is, what will it take, what do you need? In my mind, reform means we're fixing a system that's already in place. And we know from what Evelyn just described that the system that's in place currently is based in so many ways and in so many and steeped in structural racism and white supremacy. And to reform that is just changing and recreating things that are still within that system. And I think we need to be thinking a lot more broadly and a lot more reimagining in a way that allows for a different option.
I would be nervous just for the public health effect of police abolition. I think we have a lot of good evidence that when police—
Don't be nervous, John. You can make it.
We have good evidence that public safety is jeopardized. So, I mean, I think, a reimagined version of policing that some of the folks like Edwin have been discussing, or completely reimagined, would also require a lot of thinking about what the alternatives would look like. Who's going to do the work? How are they going to be deployed? How is it going to be staffed? So are they going to be public health officers, social workers? What programs can we draw on where there's some evidence of them working? And recognizing at the same time, there are going to be situations where I agree 100%. You don't need someone with a gun to respond to most situations, but there will be situations where you do, and you can't say sorry. They're not available. So I mean, I think there have to be some real thought of personnel planning. How do you design a new system? And I haven't seen any thorough policy analysis of that yet. It's certainly doable, but it needs to be proposed and thought through so that it isn't just kind of a utopian ideal that in reality ends up being a problem, especially for the most disadvantaged communities where that'll bear the brunt of what happens the most when, say, if police were abolished, if that were to be kind of the objective. So I would be nervous about that. I understand they don't, use your imagination. I think, though, in the area of police reform, we haven't tried enough in police departments. And I don't mean just training, but changing the incentives so that when officers are deployed, that their job isn't, warrior, just crime fighting, but it's, trying to engage in the community more, real community policing. There have, been attempts to do that, but I don't think that they've had as much sticking power. And part of the reason is just, again, the organizations have to design incentives for officers to do things like have friendly conversations with people for years. In fact, going back to 2009, I've been trying to advocate with people in the policing profession for trying what I called officer-friendly experiments, where you actually incentivize officers to go have friendly conversations with people to build trust. The argument being that you probably get the same public safety benefit without all the negative collateral consequences that people definitely feel when they've been stopped unfairly. They may be frisked. All these things that generate serious trauma for people. If you flip it around and there was more effort to try to have police engage in just, friendly conversations, where still, if there's criminal activity at hand, they'll be acutely aware of it because, community members will give them a tip, will give a suggestion, or will clearly, there'll be some other manner of the interaction that makes it clear, like, this isn't just a friendly conversation anymore. That's just kind of one example, but there's a lot more that could be done. And the solutions aren't, as Chief Ramsey had mentioned, aren't simply just training. Training is important, but training alone, it has to be how people practice what they're doing in the community that really is going to lead to the types of a different model of policing. But I'm definitely, I would say I would be concerned based on past evidence of police abolition. But I'm
going to jump in here, John. I appreciate what you provided us. I want to start with the fear of abolition. I know that when I say that, for many it's inflammatory. It's fear. What happens when the killers start roaming the streets? What happens when all these things are, who's going to handle them? And the truth is that there are communities in this country right now that live with no police in their community. In Queen Anne of Seattle, the wealthiest neighborhood in Seattle, has no police roaming their streets at all. They get to call them, absolutely, but it's because they get to protect the property of white freedom. In the south end of Seattle, which is predominantly Black and brown and Asian, they treat our main thoroughfare as though it's their driveway, and they're there on a daily basis. So people are experiencing an element of abolition already, and they love it, right? They say the police are great to me because I don't ever see them. But data also shows us that if police are in neighborhoods, in predominantly wealthy neighborhoods, people get upset because they feel as though it diminishes the value of their home. So they don't actually want police in their neighborhood. The second point I want to make is I struggle dearly with the analysis that we should incentivize good behavior. That should be their job, right? Their job should be to provide a fundamental humanity to community. And if we're incentivizing anyone how about the most marginalized in their communities? Because most of the crimes that do take place, I would say over 75%, are crimes that are because of poverty, because of survival. For the other 25%, there's a mental illness that is involved in some capacity that we should also be addressing with investment in that community. But I really struggle when we're saying, let's invest more money in an apparatus that has proven, if we talk about data, that has proven ineffective in many capacities. And not only are they ineffective, but my taxpayer money, at least in the city of Seattle and many cities and counties around the country, when there is settlements for police misconduct, our taxpayer money pays for those settlements for the harm that they're causing to my community. The absurdity of that logic does not fail on me. And I'm asking for a refund. I would like our communities to get that money back. If we give people a home, food, and education, crime will go down because there's not a necessity for it. I don't know if investing more in policing actually addresses the harm, but I think to Chuck's point, I want to address as well, it's much better, much broader than just police. One of the largest budgets in every city is policing. And if they actually want to stop crime, then I actually think they should start looking around saying, we need to start addressing poverty. What can police do to address poverty? What can it do to address systemic racism? What can it do to hold the elected officials account for the violence that's actually occurring in our communities, like concentrated poverty, like the harm of undereducating Black and brown young children, the harm of getting poor access to healthcare? I don't see police taking a position on that, ever. But they say that the goal is to decrease crime, and we know what the source of many of these crimes are. The last point that I want to make is abolition, again, is not scratch it, that's it. That's really, that's elementary analysis, I think, of what abolition is. Abolition is the white woman in Pocatello, Idaho, just 2 days ago, that called up the wildlife services because her son stepped on a cyanide bomb in her backyard and nearly killed her child, and it killed their dog. And what did they say? They said, we need to abolish cyanide bombs as a tool for killing bears, raccoons, and wolves. They could have said, well, can we make the cyanide bomb safer? You can keep it in my backyard, but just make it safer for my children. No, they said, get it out of here. I don't want it at all. Let's find a different way to accomplish the goal that you want. For us, it's, again, as Dr. Hardiman mentioned, this is my last point, it is reimagining, again, what that looks like. Deconstruction is the easy part. The hard part, as you mentioned, John, how do we build this up? And I don't know if I've been in communities where there's no police because the community is protecting themselves, and it feels incredibly safe. So maybe the data just hasn't been published yet, but I think there's sufficient data to suggest that there could be communities that don't need police in the manner in which they are presented now.
I think if we reimagine public safety, not just policing, but public safety and what's encompassed by that term, then I think we can start to build something that's going to work and be sustained as long as it's financed properly. And one of the issues, I mean, the police have picked up all these different roles. Why? Because at 2 a.m, who else is around other than police officers or firefighters? If you wake them up, of course, go fight a fire, but nobody's around other than that. You don't have social workers working. You don't have substance abuse counselors that are going to be available to respond directly to that particular complaint. And so over the years, police have been the lead on those things, and that's inappropriate. We should not be the lead, although I agree with John, there are going to be a lot of these cases because there is some danger involved with some of these calls where you play a secondary role if needed. But the primary responder could be these social services. And when I hear the conversation is taking place now, okay, defund the police. All right. And you get deeper in the conversation is reallocate the money. Okay, go to community-based social services. My recommendation, follow the money. Cities have a habit of taking money out of budgets, plugging gaps here and there, but it's going to take a lot of money to staff these different agencies up properly so they will be available. And I'm all for that, and wherever you draw it from, but don't take the money and then leave the responsibility where it is right now, which is what I fear probably will happen. And if people aren't careful and don't really pay attention. I admit I'm biased, having been a cop all my adult life. So I think that when we start talking about abolition and things of that nature, and I'm all for cutting back on police because I'd love to live in a society where police aren't needed, but we need to strike the right balance, and we need to have a plan because there is real violence that takes place in some of our communities, unfortunately. Everyone's not wealthy. Everyone doesn't see, police is just, they're there if I need them, but I don't need to see them every day. There's legitimate crime taking place out there. And so how do we strike that balance of policing? And I think what many people want, at least from the community meetings that I've gone to, it's not that they want no police. They want constitutional policing. They want good police. They want police that respect them. And that's not asking too much. And that's what we ought to be providing. And we ought to be, 911 should be the last thing you should ever need to call because everything is fine. But if you do call, then you ought to get a response that is no different if you're on the west side of Chicago or you're on the Gold Coast of Chicago because, one group has money, the other group doesn't have money. The quality of the service needs to be absolutely the same. And it ought to be the very best. And it ought to be constitutional in terms of stops, constitutional, anything that police officers do needs to be within a constitutional framework. If we can accomplish that, then I think we've gone a long way toward reimagining. And when I talk about reimagining, I don't want to leave out community because they have a role too. I mean, police can go into an area and maybe kind of suppress crime for a period of time or what have you. Only the community can sustain it long term. And so communities got to get more engaged and got to get more involved too, because we need to work together in order to have an impact. And one last point, we have to also change how we measure police effectiveness. At the end of the year, you can go to all the community meetings you want. You can problem solve. You can sit on the stoop with Ms. Jones and have a great conversation. At the end of the year, the media is going to report one thing: are your murders up or down? That's it. The violent crime. That is it. That's the only thing they're going to look at. Shootings, homicides, violent crime. We need to find, not that that's not important, but it can't be the only measure. If we want police to perform differently and get credit for some of the other stuff, then we need to be able to recognize it and have some other things that we look at in terms of measuring effectiveness for public safety. Can kids use that park now? Can families, sit on their front porch and not worry about any kind of anything happening? Traffic safety. I mean, there are so many different dimensions to it. Let's measure all of it, not just one thing. The one crime that occurs with the least amount of frequency is the one thing at the end of the year is the only thing that's really measured and is the determining factor. So we need to all kind of rethink what's important in terms of what public safety should really mean if we're going to have anything coming from discussions like this.
I agree with much of what Ramsey was saying. One thing I would add is, thinking about reimagining police, and the police function around a public health or public safety function. I think it is really important to think about the structural aspects of communities, and particularly the crumbling infrastructure, whether it's parks, vacant housing, abandoned spaces. And we're just not spending enough money fixing up communities. And I think you would rely on the police a lot less if we spent a lot more time rebuilding, redesigning communities to make them safer and healthier places. And I don't see a strong political resistance to that. I mean, if you can get everyone, to agree that this is good. I mean, there's economic returns to reinvesting in communities. That'll pay off for generations. And we've been letting kind of the infrastructure of all our cities fall apart over the last 50 years. And so we really should be thinking more strategically about how to engage communities, community groups, to figure out how to redesign the communities that they want to live in. And the police could even play a role in some of that. But following on Commissioner Ramsey's point, you got to follow the money to programs that actually work. that can be scaled, that have some evidence of effectiveness, so that this isn't a wasted opportunity.
So thanks, John. I'm gonna direct a question to Rachel here. That I'm seeing in the audience, and also in relation to Chuck's comments, in terms of engagement, and communities need to be engaged with police. We've talked about the negative health effects on Black communities of police. There's clearly a lack of trust. Why should communities even step up and work with police given the negative effects of policing on these communities? And how might we move forward with that? How might that occur? That's one question that I think I'd love your perspectives on.
I actually don't know that communities working with police is the right sort of next step. I think that, all of the comments that we've just heard, create the case even more so for why police violence and policing and is a public health issue, right? And that so much of this is steeped into where we live, where we work, where we play, where we worship, and taking a step back to understand policing and police violence as a indicator of community health in the way that we look at infant mortality, right? We look at, infant mortality rates have always been held up as an important indicator of the health and well-being in communities, and as one of the critical indicators of public health. We don't do that with policing. And I think as a result, the conversations that we're having now are starting to lead to that and starting to sort of open up these doors for these conversations. But I don't know if the first step is actually a conversation between community and police. I think it's a conversation between community and, within community really, and thinking about, again, like what do we want? What do we see as the next steps? And then putting that down and asking for it and demanding it. We have seen so many innovations happen in the past couple of months as we have responded to COVID-19. And, so it's not that it can't be done. It's, it's it's demanding the resources to make it so. I think earlier it was Edwin who laid out the statistics around, the fact that, 1 in 1,000 African American men are going to be killed by, are harmed by a police officer. And there's plenty of other statistics. Dr. Rhea Boyd always uses the point that, that's the same mortality rate of measles, right? So, which we consider in public health to be an incredibly deadly and highly, contagious infectious disease. And yet, we've put the resources and the funding behind studying it and behind making sure that it's not transmitted and containing outbreaks. And I think we have to start by really thinking about and framing structural racism and police violence in that way.
Thanks, Rachel. Other thoughts? Go ahead, Chuck.
I realize the topic here is around policing and police violence and so forth. It is a public health issue, but violence in general is a public health issue. It's not just police. We still average 14,000 to 15,000 murders a year in this country. And I'm not talking about police shootings. I'm talking about homicides, when one person is killing another person, murder, and so forth. And so I think we need to look at violence, period, as a public health issue and try to deal with it. Because when you talk about what's been termed as over-policing and all these kinds of things, I mean, I've been in a position where I've had to deploy resources. I've gone to community meetings and people tell me I didn't have enough police officers in certain areas as opposed because they're afraid and they see the violence that's taking place. I've witnessed it myself. I grew up in a challenged neighborhood on the south side of Chicago. I saw my first homicide when I was 14 years old when my brother's best friend was murdered for not being in a gang by a gang member. And so, violence is real. Now, I'm not minimizing when it's even worse when it's at the hands of a police officer because we're here to protect people, take an oath to protect people. So, yeah, it is magnified. I have absolutely no problem with that at all. But I do think that we lose something when we ignore the reality of what's happening out there on the streets. All lives have value, and we need to look at the stuff that's really taking place out there on the street, and we have an opportunity to address all of it as opposed to just thinking if there weren't a single police shooting that took place in a year, you'd still have 14, 15,000 people murdered. I mean, so is that progress? I don't think so. We need to try to get down to zero for everybody, period. And we can do that, holding police accountable, holding everybody accountable.
I completely agree, but isn't the purpose of policing to decrease crime? And if that's true, then why is violent crime going up when we're investing more in policing?
Because of all the other things we've been talking about here. You still have people that are unemployed. You still have poor housing. You still have dysfunctional educational systems. You've got kids out here that honestly don't believe they're going to live to see 21 years of age. I mean, it's terrible. If we don't fix that, if we don't give kids hope, if we don't deal with poverty, if we don't deal with all these things, then yeah, it's not gonna change. You'll have little blips here where one year the crime is down a little bit, another year where it's up a little bit. But have we fixed the problem? No. I mean, Philly's one of the poorest big cities in the country. I think the poorest big city in the country. There's only so much you can do if you don't fix the infrastructure was really driving crime, and that's all the other factors is driving it.
Yeah, and I appreciate the answer, and I completely agree. But where do we're taking money from those things to provide it to police and militarization.
We're in a catch-22. That's what cities been doing. They've been borrowing from Peter to pay Paul. At some point in time, you got to sit down and figure out, how do we make a safe community? How do we make Philadelphia safe for everybody? I don't care if you live in North Philly, if you're in Northeast, I don't care where you are. It should be safe for everybody. And what's it going to take to get us there? There's a lot of money that's being collected, and in my opinion, some of it's being squandered, quite frankly, with stuff that don't work. We invest in the things that don't work. And yeah, more police. That's not the solution. It's not the solution. But it's not an either-or proposition is all I'm saying. And we need our city leaders to sit down and think this through. Bring in community folk, bring in everybody you can, and come up with a plan and a strategy and fund it and understand it ain't going to happen overnight. But begin the process, because right now all we're doing is borrowing from Peter to pay Paul, and that ain't going to work.
So this is absolutely probably a perfect place. We only have 1 minute left. So clearly, I open this saying this is a societal problem, and police are a function of society. We're hearing that one of the questions in the chat was, what's the crosswalk between what we have and where we need to go? And I think Chuck's comment and Edwin, everybody's comments on how do we make that transition, because it's a distribution of resources and values in terms of improving public safety. So we're going to have to end there, because I need to turn this over to Rachel to close us out. But I would love to do like a part 2, a part 3, a part 4 with this panel, because it's such an absolutely fabulous discussion on a complicated topic that requires, it's going to be a marathon. And thank you so much, panelists. And I'm going to let Rachel have the last say here.
Well, I'll just follow up and echo Terry's comments, which are thank you so much to the panelists, and also thank you to Terry. It's been such it's been a great discussion, and I hope that this is just the beginning, and I'd love to see a follow-up on this also. Thank you, everyone, for signing on and participating. LDI is going to be holding its next seminar in the fall, so I hope that we can see you all then. Thanks again.